a registered dietitian.
Hi, I'm Kevin. I'm a registered nurse.
We are the certified diabetes educators for the Shoshone Bannock Tribe's Diabetes Project.
We have put together a series of videos using materials from the International Diabetes Center and our tribe to answer some of the basic questions of diabetes.
Let's talk about kidney disease with diabetes. According to the National Kidney Foundation, kidney disease affects about 26 million Americans, but most don't know it. 1 in 3 Americans are at risk for kidney disease. To better understand kidney disease, it helps to know what the kidneys do. Kidneys balance the fluid in the body, they filter the blood, they regulate blood pressure, they balance minerals and electrolytes in the body, and they stimulate the production of red blood cells. Kidney disease means that the kidneys stop working well, but doesn't mean that they are dead. They just can't filter the blood as well, make the red blood cells, get rid of extra fluid, or do the other things that the kidneys do normally. Diabetes is the leading cause of kidney disease. Nearly 20% of people with diabetes have kidney disease. High blood pressure is the second leading cause of kidney disease. Approximately 160,000 people in America have kidney disease because of high blood pressure, and about 26% of Idaho adults have been diagnosed with high blood pressure. A blood pressure of 140/90 or higher is considered high blood pressure. High blood pressure can be caused by smoking, obesity, lack of exercise, high cholesterol, and diet. Some other factors include heredity, gender, and race. Blood pressure can be lowered and managed by losing weight, using a healthy eating plan, such as reducing the sodium in your diet, limiting alcohol, and choosing lean meats. Adopting an exercise program is also a good way to lower blood pressure and stop smoking. Taking your blood pressure medicine as directed by your provider is also important.
Some other causes of kidney disease include kidney stones, frequent infections, autoimmune diseases, and cancer. Some people are also born with bad kidneys or scarring from various problems. Overuse of anti-inflammatory medications or other prescribed medications can also affect the kidneys. Follow up with your doctor if concerns arise. Your doctor will be able to tell how your kidneys are functioning by the symptoms you have and blood tests. He'll be able to see toxins in the blood, waste products in the blood, and assess your glomerular filtration rate, or GFR as it is commonly referred to. The GFR is an estimation of how well your kidneys are filtering your blood and is estimated from a measurement of the creatinine in your blood levels. Creatinine is a waste product formed by the normal breakdown of muscle cells. Healthy kidneys take the creatinine out of the blood and put it in the urine. When the kidneys are not working well, creatinine builds up in the blood. As you get older, the average GFR number is lower. A GFR lower than 60 suggests some kidney damage. This means that your kidneys are not working at full strength. GFR is broken down into 5 stages. Stage 1 is kidney damage with a normal GFR that shows protein in the urine. The treatment for stage 1 kidney failure is to focus on blood sugar and blood pressure control. The GFR is 90 or above. Stage 2 is where the kidneys have damage with a lower GFR. The range for this is 60 to 89. The treatment here is estimating the progression of kidney disease and preventing further progression. Stage 3 is kidney damage that is causing some problems such as anemia, acidosis, changes in calcium and phosphorus levels, and retaining fluid. The treatment for this is based on what the complications and problems are. Stage 4 kidney disease is fairly severe with a GFR of 15 to 29. This will be followed up with more lab tests, treating the symptoms, and a referral to the nephrologist. He will focus more on controlling blood pressure, anemia, and address the cause of kidney disease. He may order an ultrasound test of the kidneys or other tests that may help manage kidney disease better. At this time, education and training on kidney replacement therapy and treatment options will take place. Stage 5 is kidney failure with a GFR of 15 or less. This is where people will typically initiate treatment options.
Treatment options, or replacement therapy as it is called, include peritoneal dialysis, hemodialysis, a kidney transplant, or simply to do nothing. Peritoneal dialysis is a process where the fluid is placed into the stomach around the intestines and the blood is filtered. The fluid is weighed and measured and recorded. It is important with peritoneal dialysis to weigh yourself and the fluid taken out. Hemodialysis is a process where the blood is pumped through a specialized filter which pulls the extra waste products and fluid out of the blood and is returned back to the body. This is done at a dialysis center, and it takes 3 to 4 hours. A kidney transplant is done with a donor, whether living or dead. A person will meet with the transplant team and discuss requirements and guidelines. A family member can be a donor of the kidney as well. Prevention is the key to protecting your kidneys. Keeping your blood sugar under control will make a huge impact on kidney protection. By having your A1C or your 2 to 3 month blood sugar average below 7 with your blood sugars less than 140. Meet with your provider frequently in knowing what your labs are, such as your GFR, your protein in your urine, creatinine, and other kidney tests are. Monitoring your blood pressure and keeping it less than 140/80 will also have a big impact on protecting your kidneys and preventing chronic kidney disease. Weight management, exercise, and nutrition play an important role in kidney protection. When looking at nutrition, it is important for a person to decrease the protein in their diet, decrease added sugars and salt, limit the foods that have potassium in them, such as oranges, potatoes, and tomatoes. Speak with us for more information on a renal diet. It is also important to drink plenty of fluids unless otherwise indicated by your provider. You will need to decrease some medications such as ibuprofen, naproxen, or other over-the-counter non-steroid anti-inflammatory drugs. Remember to take all medications as directed by your doctor.
Goals to consider at this time include monitoring your blood sugar and keeping it in target range, blood pressure control of less than 140/80, and taking medications as directed. Exercise and nutrition are also important.
For further questions regarding any of these topics we've covered today, please contact us at any time for an appointment. Thank you.